Welcome to the Physical and Occupational Therapy Workshop brought to you by the Health Professions Advising Office at the University of Maryland. Today, we will be covering the essentials for being able to apply to PT or OT programs and their timelines. So what are these professions? Physical therapists work in private offices and clinics, hospitals, and nursing homes. They help injured or ill patients improve movement and manage pain using exercises, manipulation of joints and muscles, and training in functional movement. Occupational therapists work in OT offices, hospitals, schools, nursing homes, and other home health services. They help injured, ill, or disabled patients develop, recover, and improve skills needed for daily living and working. Doctorate of PT programs typically last 3 years and have the option of doing 1 year of residency. There is no longer the option of getting a master's of PT. Masters of OT programs last 2 to 3 years depending on the location, and doctorate of OT programs last 3 years. The median salary for both of these professions in 2016 was around $82,000. How do you know if you are competitive for the programs you are interested in applying to? To be a competitive applicant for PT and OT programs, you need to align yourself well in the following categories: GPA, observation experience, letters of recommendation, the GRE, and other relevant experiences like leadership and community service. In today's workshop, we will cover all of these topics as well as the timeline for applying to these programs and what your personal statement should look like. It is important to remember through this workshop that each PT and OT program can vary vastly. So it is important for you to do your research when making your school list to document the differences in these programs and set yourself up for success based on those differences. Your academics are what is going to get you in the door to these programs. Your undergraduate GPA is the most important aspect of your application. If you are not meeting the required minimum GPA for programs, your application will most likely not be reviewed. Let me answer some commonly asked questions. Which is the best major for PT or OT students? This is a trick question because there is no such thing as the best major. A student should pick a major based on their interests and passions, not what will look best to programs. Professional schools do not have a preference for a student's majors. What they are interested in is their GPA and grades in the prerequisite courses that they are asking applicants to have. It will be a wise move for a student to pick a major based on their interests and what aligns best with the classes they need to have for the programs they are interested in. For example, kinesiology students have a passion for their major, but it also aligns well with the prerequisites for most programs. Students may have to seek classes outside of their major as well in order to meet the prereqs. Do minors matter? Minors do not matter. If a student is interested in pursuing a minor, then go for it. We want students to pursue their passions, but professional programs do not care what a student's minor may be, as long as you are doing well in the classes. Do I need to declare being pre-PT or pre-OT? UMD does not have a pre-OT or pre-PT major, so there is nothing for a student to declare. It is essentially self-declared, so if you are interested in going to PT or OT schools, then you are a pre-PT or pre-OT student. Can I take summer classes, and can I take them at a community college? Fortunately, PT or OT programs do not care how and when the prereqs they are requiring get done, as long as they are done well. So, that means you can take any and all classes for these programs during winter, summer, spring, and fall, and at 4 or 2 year institutions. Should I retake a class to increase my GPA? Get the highest GPA possible while you can. Retake the class. Typically, you want a B- in the prerequisites. Postbacks are factoring into you as an applicant once you meet the undergraduate cumulative GPA. That is the most important number. Here are some similarities and differences in the prereqs required at most programs. Now we are going to talk about the relevant experiences needed to apply to PT and OT programs. Again, it is important to check the individual program's website to get specific information for what they are asking and incorporate this into your school list. But for the most part, the experiences you gain in clinical need to be across the lifespan. This verbiage comes directly from Karen Gords, the Chief Learning Director of the PA Leadership Learning Academy at the University of Maryland in Baltimore. Across the lifespan is exactly like it sounds. Applicants need to have experiences spanning from pediatrics to geriatrics and everything in between. Why is this important? Because these experiences are going to reflect what you will be learning in PT and OT programs. So learning and experiencing them prior to getting there will help you be a better student once you are there. Not only will you be hearing what the teacher is saying, but you will be thinking back to an experience that you remember. When crafting these across the lifespan experiences, schools will be looking for 2 or more longitudinal experiences in different settings with different populations. These experiences need to be the meat of your application. By longitudinal, I mean spending months at one place and a couple more months at another. These 2 different populations and settings need to be exactly that. Think of them like working in a hospital with pediatrics and then an outpatient center with geriatric patients. This is the most basic example of what programs will be looking for, but these populations can be anything you are interested in. I encounter a lot of students interested in dance and where dancers go when they get hurt. One of these settings will need to be in a hospital, but the rest is up to you. When you are not out getting these longitudinal experiences, one and done days in a specific setting or working with specific populations is perfectly fine. That is how you are going to gain this across the lifespan experience. These can be burn units or weekend workshops, anything that is helping you gain experience. These experiences must be hands-on clinical experiences as well, because you're going to have to be able to talk about these experiences in your interviews. If you worked in an outpatient center, but worked behind the desk for the entirety of your experience, interviewers will know just by how you are speaking. Keep that in mind. Here are a list of potential settings that you may be interested in gaining your experiences within. The last 3 are specific places close to UMD that you may want to look into as well. Again, having experience in a hospital is important. Also, remember that any experience is good experience. Being a wheelchair runner may not be the most glorious job, but it is super important to understand how to help patients in and out of wheelchairs with certain injuries and at certain ages. You will learn something from everything that you do. If you are struggling to find experiences, I recommend checking out APTA's website for PTs. They have a section called For the Public and a database that allows people to find a PT for their health. Well, you should think about using that resource to find a PT to shadow. Community service is going to be another important pillar of your application. Programs will want to see your commitment to the community you are residing in, as Karen Gords said to me. They want to see that you are giving back and are already actively engaged prior to enrolling into their program. There are not going to be a set amount of hours or months that you need to be civically engaged, but schools are not looking for one-and-done experiences for community service. Think of it like a job. People or communities are depending on you to be there and make a difference. Certainly, the trips abroad to serve in other countries are good experiences as well, but they can cost more money than getting engaged in your own backyard. Research is not something that an applicant should stress themselves out to gain for the acceptance into PT and OT programs. These programs are often more consumers of research than they are producers. Programs at UMD, like FIRE, are great ways to gain some exposure to research, and you can certainly put them on your application to schools, but research is not a necessity in order to apply. Leadership is important to show on an application as well. This does not mean you need to be the president of a student organization. You can also show leadership through all of your community service, clinical, and coursework. Leadership will be able to show in your letters of recommendation as well. But, shameless plug, UMD has 2 really great student organizations that I encourage you to check out. The Pre-PT Association and the Pre-OT Association Both bring in awesome speakers on campus and give you the opportunity to build your network in this field. Check them out. You can find more information about them at the first link on this slide. Also, we have an alumni contact list database that holds the current contact information for TERP alumni who are currently in PT or OT programs. This is an invaluable resource. You can find it at the second link listed, or just search our website for the alumni contact list. It's password protected, and the password is health7954. So, how do you keep track of all this? A school list is a necessity. This will help keep you organized and sane throughout this process. How do you start to build your school list? Utilize the school directories through the national organizations. APTA and OATA have lists of all the respective programs in the United States on their program directories. The easiest way to find these resources is Googling PT School Directory or OT School Directory. Some things you are going to want to incorporate into your school list is average GPA, science GPA, GRE requirements, admissions deadlines, prereq classes needed, contact information for admissions representatives, and more. The list is endless, but it is important to make your school list early and update it often. Your school list is going to change with how you evolve as an applicant over the next few years. Something else you should consider, but will take a little digging, is the type of curriculum the program has and how it fits you as a person. For example, Temple's OT program has a very community-based curriculum, which means they go to non-traditional clinical sites. Another example of how important community service is throughout the application process. Here's an example of what your school list may look like. You can house your school list in Excel or any other program that may work best for you. The amount of schools on your list can be limitless or very minimum. My only advice for this is to never apply to a school that you know you would never attend. This could be because of location or any other factor that matters to you. The distance from X on this example is the distance from whatever is important to you in terms of location. This may be from the beach or the mountains or family or significant others. Truly anything. This is your school list, no one else's. So tailor it to you and things most important to you. Since we're talking about how to keep track of things, how about those hours? You are certainly going to want to keep track of the clinical hours and experiences that you do throughout the time before you apply. Again, this can be any way that fits you best, but a lot of students will journal about their experiences extensively after each shift, or jot a little note or two in their iPhones about what happened during that shift. This is helpful when it comes time to interview. You can quickly go back and refresh your memory about events that took place that you may want to talk about in essays, personal statements, or interviews. Now onto the general timeline for applying to these programs. Applications open generally around the end of the spring semester or the beginning of the summer, so you're going to want to know those exact dates when they come out. You should be submitting those applications at least 3 weeks before the deadlines you have. This gives time for things to be verified by application services because your application must be verified in order for it to be sent to programs. Things that may trip up this verification include transcripts not being sent in a timely manner or not finishing the main application piece online. The GRE will need to be taken way before you submit your application as well, because this score must be sent to the application service and verified to be included in your finished application. Once the deadlines have come and gone, typically around the beginning of the fall semester or end of October, that is when interviews will begin, and these will last far into the spring. Decisions will come out at all different times depending on the programs, but once May hits, you will be matriculating. As previously stated, you must meet the minimum requirements for a program for your application to be reviewed. PT and OT programs are not holistic in this regard. However, once you meet those cutoffs, your application will be reviewed holistically among the other candidates. This is because there are far fewer programs than other professions, and they are very competitive. There must be a cutoff of applicants somewhere. When taking the GRE, if you are not happy with your first attempt, go ahead and take it again. Finances permitting, of course. Programs super score, meaning they take the highest score from each section of the GRE. Your GRE score will last 5 years. Here are some tips. Ask questions. Never speculate. Get a direct answer from an advisor or an admissions representative from the program. That's their job. Gaining as much experience as possible will help you worry less about whether or not you are a good enough applicant. It may even lead to a new passion and will give you more stories to tell during essays and interviews. Student groups are helpful for connections and camaraderie. Why go through all of this alone? Bounce ideas for clinical experiences off of each other. Study together. Be successful together. Only apply to schools you would actually attend. Don't waste your time or theirs in applying. It's a lot of work and a lot of money to apply to schools that are of no interest to you. Read, read, read. You will be asked in interviews about current events in healthcare and PT or OT. Be knowledgeable. Lastly, think outside of the box for your experiences. I told you the story of my students interested in dance because that was their passion, and that is the story they wanted to tell about themselves as an applicant. That was their theme. Think in that frame for yourself. Here are some invaluable resources that you should certainly check out right after this. Thank you for spending time listening to this workshop, and as always, please reach out to the Health Professions Advising Office if you have any questions.